Welcome to In Alignment, Life, Leadership, and Dentistry. I'm Dr. Sarah Mahmood, dentist, aligner educator, speaker, and mom of three, navigating the wild ride of clinical practice and family life. This podcast is your go-to space for all things clear aligners with real talk on dentistry, leadership, and the juggling act we call life. Whether you're looking to level up your aligner skills, build more confidence in your workflow, or just feel a little more seen in this season, you're in the right place. Let's get in alignment and grow together. We tend to think of crooked teeth as a cosmetic issue, something that affects how your smile looks, but let me be clear, malocclusion, crowding, spacing, bite issues, these have real health consequences. This is not about appearances. It's about long-term function, comfort, and systemic health. In the last episode, I talked about co-discovery through intraoral scanning and how showing patients really can build trust when you show them their scan. Today, I'm going deeper because when patients understand what misalignment is doing to their health, they're far more likely to say yes to treatment. So let's break it down. What's untreated malocclusion and what can it lead to? Number one, increased risk of cavities and gum disease. Crowded teeth are harder to clean, food and plaque builds up, bacteria settles in, and suddenly you've got a perfect storm for decay and chronic inflammation. Number two, abnormal teeth wear and enamel erosion. When teeth don't meet evenly, certain areas take the brunt of the force. Grinding and clenching are common in misaligned bites, and they lead to chips, fractured, and flattened surfaces. Number three, TMJ dysfunction and chronic pain. A poor bite strains the jaw joint. Patients may report clicking, tension, headaches, jaw pain, or even migraines. And overworked facial muscles, they don't lie. Number four, sleep and airway issues. Narrow arches, misaligned bites, they impact airflow, contributing to snoring, sleep apnea, and chronic fatigue. This isn't just a dental issue. This affects overall well-being. Number five, confidence and mental health. Malocclusion affects how patients feel about themselves. Anxiety, social withdrawal, low self-esteem. It's real and it matters. Number six, systemic health risk. Chronic inflammation in the mouth is linked to heart disease, diabetes, and other full body conditions. Your mouth doesn't operate in isolation. It's part of a larger picture. Number seven, chewing and digestion. A poor bite makes chewing inefficient, which affects digestion and nutrition. Patients often favor one side, creating strain and discomfort. So how do we bring the patient into this conversation? It starts with your team. Hygienists could say during a cleaning, "Hey, Susie, I'm noticing plaque building up in some tight areas. Crowded teeth make it harder to clean, which increases the risk of decay and inflammation. Have you ever noticed bleeding when you brush? Aligners can actually make your teeth easier to clean and keep them healthier." Assistants taking a stand might say something like, "Hey, Susie, I'm noticing some uneven wear on your front teeth. That can happen when the bite is off. Do you ever feel sensitivity or notice things feel uneven when you chew?" The doctor can talk to you about that. And then the doctor walks in and says something like, "Hey, Susie, take a look at your scan. See how these back teeth are not meeting evenly? That extra stress can cause premature wear and even fractures. And actually, this narrow arch may be impacting your airway. Do you ever wake up tired or deal with snoring?" From there, you reframe aligners as a health-based solution. We align these teeth properly and we balance the forces, improving your function and protecting your teeth, and maybe even improving your breathing. This isn't just about looks, it's about preserving your health. Now, once that groundwork is laid, the transition to aligners becomes seamless. Your hygienist might say, "Hey, I let Dr. Sarah know about the crowding and some sensitivity. We talked about how the aligners could really help make things easier to clean and protect your long-term health." Then the doctor can say, "Sure Smile Clear aligners allow us to correct these issues gently and efficiently, not just for a straighter smile, but for better long-term function, comfort, and oral health." And here's how you make this work at scale. Build function and health into every intraoral scan review. Train your team to connect alignment with real risks. And use simple, patient-friendly language to explain bite issues. And most importantly, document and communicate key findings so your messaging stays consistent. When patients realize that misalignment isn't just about vanity, but about preventing future problems, protecting their teeth, and improving their overall health, everything shifts. This is the next level of co-diagnosis. This is how we stop selling and start serving. We'll keep building on this in the next episode.